We live at the crossroads of academia and real-world medicine. It is a place where you can do research and provide education that is meaningful and connected to our community.
Although we've made improvements in how we treat cancer patients, we have a far, far way to go. And one of our big drivers for that really is research. I mean, we see that we've made dramatic improvements in the survival of patients with breast cancer, and that's a direct result of research and the improvements we made in our treatments and screenings for patients.
The doctor tells me that I have breast cancer. Wait, are you telling me I have cancer? She said, yes, I'm sorry, you have cancer. And I hung up the phone and I was just in the zone. There's one thing to have friends and family that you've watched fight it, but for it to happen to you. When I came back to see Dr. Whitaker, I told her I had decided to do the clinical trial.
So Lisa, she actually participated in a clinical trial called the I-SPY 2 study, for things like investigator-initiated trials where we don't have a funding source. Philanthropy dollars really do kind of come into play there.
The thing that I am most grateful for is the amount of care and the financing that goes towards this trial that I'm on. And the support in the whole treatment trial has just been incredible.
The whole purpose of clinical trials are the patient advancing their future lives. It's all about giving them hope to live, right? And to see their kids growing.
And what excites me about it is to see a great health system come together with a very proud, long-standing university that prides itself in excellence of education, research, and connection to the community.
I've been lucky enough to be here the entire 25 years and really see the evolution and progression of academics at MedStar Health, at Georgetown University, and our efforts combined. And it's really that combination that over the last 2.5 decades has really propelled academics.
I look at the strengths of Georgetown. It has the med school, the School of Health, the School of Nursing, then a law school and a policy school. And then I look at the scope and scale of MedStar, 400 sites of practice, 10 hospitals, and just this commitment to come together. I see us as truly extraordinary. And what I also really like is that this relationship isn't a new one. We have 25 years of momentum, which really puts us way ahead of so many other organizations that are trying to respond to giving more access to health in an affordable way for people who depend on us.
Nothing truly happens in the research realm unless you have a good research team. Kittis and Stacy, who are our clinical research coordinators, are absolutely essential to putting patients on trials. And their salaries are directly funded through philanthropy efforts. Hi there.
If someone asked me would I do this treatment all over again, yes. I still had a really good life that whole year with this treatment. I found it groundbreaking. I found that it worked. I found that I was very happy as I went through this journey. I owe that to the donors for making this possible. What I would like to say to all the donors out there is that what you're doing is important. It just meant everything to me that MedStar, no matter which hospital you're at, is a team.